Good afternoon, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here in the region of Peel, and Nancy McDonald-Duncan, our Acting Fire Chief and Director of Emergency Management. Before I provide my COVID update, I first want to talk about some really great news that we received earlier today. The provincial government has announced an additional $695 million in funding to cities through the Safe Restart Agreement. Of that, Mississauga will receive $9.6 million to help balance our 2020 operating budget, as well as another $11.2 million to help the city continue providing vital services in 2021. When you add that to the $46 million we received for transit and for operating costs in August, Mississauga has been allocated more than $67 million through the Safe Restart program. And I want to give my sincerest thanks to both the provincial and the federal government for supporting not only our city, but cities across the province and across the country. Cities like Mississauga have been on the front lines of the crisis, and we know that as we continue to face financial pressures over the next few years, we're hoping the province and the federal government will continue to be there for us. This funding goes a long way in allowing us to maintain the services that our residents expect. Thank you again to Premier Ford and to our Prime Minister, Justin Trudeau, and all of our partners at the province and the federal government for providing us with this much-needed support. So Mississauga has now been in the lockdown, the grey zone, for 25 days. And what's very clear is that the lockdown measures in place have resulted in case counts beginning to plateau. Over the last week, Peel Region has averaged 448 daily cases, with Mississauga averaging 164 daily cases, and that is slightly up from the previous week. In Mississauga, we had 138 cases per 100,000, and that's up 5 from the previous week. But I am encouraged that the rate of growth has slowed down. And I believe we would be in a much worse position had the province not taken the measures that they had. I know many people have been holding out hope that we will be moved out of lockdown before the holiday season. And while the province has not yet announced their decision, we are anticipating that Peel, Mississauga, will remain in the grey lockdown zone over the holidays. Since my last update, 2 more regions in the province have been moved into lockdown, and of course those are York Region and Windsor-Essex. And I would not be surprised to learn that more regions move into lockdown before the start of the holidays. What is becoming increasingly evident from the aggregate cell phone data that we now have is that people across the GTHA are region hopping, and they're doing that much more so than they did during the first wave, to go shopping, to dine out, or to visit friends and family. And unfortunately, this is leading to more community spread. I firmly believe that a GTA-wide lockdown is needed to drive down the numbers. I know this holiday season is not what any of us wanted, but we all have to continue to listen to the advice of public health. I know how tempting it will be to make some exceptions, like going over to your neighbor's house for a cup of coffee or a casual drink, or having extended family over for a small gathering, or going to visit a loved one or to the family cottage. But I'm asking you, please, please don't do this. We've already made such enormous sacrifices, and we're moving closer and closer to the end game. Vaccines begin arriving in Peel beginning on Monday, with frontline healthcare workers in our region and in our city receiving the first doses of the vaccine. The federal government is securing more, and soon the province will be able to vaccinate not only frontline healthcare workers, but vulnerable residents in LTCs, long-term care homes, seniors, and those living in other congregate settings. Then hopefully by April, we will begin to see wider community access to the vaccine. The reality is that not listening to public health advice is going to result in a spike in cases. We saw that after Thanksgiving. Even more, we saw it after Halloween. We saw it after other holidays in November. And now I'm extremely worried we'll see even a larger spike after Christmas. And this could mean that we will face a prolonged lockdown in January. It's really that simple. Our small businesses will have to remain closed to in-person shopping and dining. Gyms and recreation centers, event spaces will have to remain closed. And people will have to continue to limit their in-person contact to just their immediate households. I really hope that that's reason enough for you to listen to the rules over the holidays. If it's not, then I want you to think about the situation that our hospitals are facing. Because right now, Ontario hospitals are dealing with more than 900 COVID cases, close to as many as there were during the peak of the first wave. The province is now asking hospitals to prepare to activate emergency plans immediately. For hospitals in the grey lockdown zones and in the red control zones, that means clearing 10 to 15% of their beds for COVID-19 patients. Right now, Mississauga's Trillium Health Partners is dealing with 90 COVID hospitalizations and almost 25 people in the ICU, and in addition to the dozens of pending cases waiting to be confirmed. The hospital is beginning cancelling some elective surgeries beginning tomorrow. And over the last 2 weeks, the hospital has been forced to transfer some patients to other facilities in neighbouring regions. Brampton's William Osler Hospital is also dealing with 80 COVID hospitalizations, 23 patients in ICU, and another 50 or so suspected cases. Also, 19 of our long-term care homes, 14 retirement homes, and 3 group homes are also in outbreak, meaning that hundreds of the most vulnerable residents are either currently battling COVID-19 or are at greater risk of contracting it. I hope that's enough reason for you to follow public health guidelines over the holidays. If not, I want you to think about the 19 Peel residents who died from COVID over the last week. That's right, 19. Think about their loved ones and what they're going through. Or the 164 Ontarians who died over the last week, and the 667 Canadians who died from COVID. We can't lose sight of why we're making these huge sacrifices. We're doing this to protect our most vulnerable residents. Your decisions over the holidays can have a dire impact on the spread of this virus, a direct impact on the number of people who end up in hospital or in the ICU, a direct impact on the number of preventable deaths that we can avoid. I want to thank the vast majority of Mississauga residents who are following public health guidelines and who will continue to do so over the holidays. But what's clear is that not everyone is getting just how serious this situation is. Over the last week, our enforcement team gave out 35 tickets to people at private gatherings for exceeding limits or mixing households, and this is extremely disappointing. And while we have no intention of sending enforcement officers to people's homes over the holidays to enforce the rules, to ensure that they are being followed, we will not hesitate to respond to calls about large gatherings. We will not hesitate to hand out fines to individuals attending those gatherings, or fines ranging from $10,000 to $100,000 for people who are organizing or hosting those large gatherings. Before I bring up Dr. Lowe, I want to again address the situation facing our small businesses. I've met with a number of business owners over the last week, hundreds previous to that, and I know the situation grows more dire each and every day, with more and more of them facing closure or ultimately bankruptcy. Once again, I am so sorry that you are going through this. And on my call this week with the GTHA mayors and chairs, we all agreed that the province needs to consider implementing a new restriction model in the new year that helps level the playing field for our small businesses. It's simply not fair that small businesses continue to be the ones feeling the brunt of these lockdown measures, while the large big box stores continue to sell both essential and non-essential items to in-person customers. It's not right, and I'm growing more and more frustrated with this obvious inequity. And regardless of where we are with our case numbers in the new year, the province needs to find a safe plan forward for the reopening of our small businesses. Waiting any longer will simply mean more and more of our businesses will permanently close. I know I harp on this every week, but I'm again asking all Mississauga residents to do everything they can to support small businesses over the holidays. Instead of buying presents at the big box stores, please buy from a local business, either online or for curbside pickup or delivery. You can visit mississaugamaid.ca to find out more about the small retailers, restaurants, etc. in your neighborhood. They need our help now more than ever. And by buying local, instead of buying at the big box chains, you're actually making a difference to our friends, our neighbors, local entrepreneurs that give back to our communities. These are our families. And now, I'd like to call up Dr. Lowe to give you his update.
Thank you, Madam Mayor. Good afternoon. As of noon today, Peel Public Health has investigated 11,486 cases of COVID-19 in the City of Mississauga. 1,068 are active, 10,132 have resolved, and 287 have passed away. Mississauga's current weekly rate is sitting at 138 per 100,000 cases, which is slightly up from 100 per 100,000 last week. And test positivity is at 6.6%, slightly down from 7%. As Mayor Crombie has mentioned, our cases seem to be reaching a plateau, but our hospital picture is yet to stabilize. And even if many of us are hopeful with the news of the arrival of vaccines, our current situation remains incredibly fragile. Let me be clear. An approved vaccine does not help you if you have not received it. Inventing seatbelts didn't immediately make cars safer. It was change over the long term that finally brought safety about. Similarly, until a vaccine is widely available, we all remain vulnerable and at risk. We can all spread COVID-19. We can all put ourselves, and more concerningly, those that are most vulnerable in our community, at risk of hospitalization, intensive care, chronic side effects, and even death. This is why we must continue to stick to the precautions as this vaccine rolls out. Our community continues to see high rates of transmission, and our healthcare and public health capacity remains highly challenged. That's why this upcoming holiday season is so vital. We are only starting to see the successes from our sacrifices. And I know that many of you might be thinking of spending time with your loved ones in person over the holidays. I understand that after a difficult year, coming closer to loved ones might be comforting. You might even be taking precautions or seeking testing to make this happen. Please, do not be seduced into thinking that a traditional celebration is possible this year. Even if you take steps in advance, there is nothing usual about this end-of-year period. COVID-19 doesn't have the same emotional attachment to the sights and sounds of the season that we do. It is simply looking to spread from person to person. This means the safest way for you to celebrate the holiday season is to stay home and celebrate with those that you live with under the same roof, or with one consistent other household if you live alone. It's the same advice that has seen us through this second wave. Holidays are not essential activities, no matter how much we love them. Please, do not hold or attend any gatherings. no matter how special the tradition. Only leave home for the most essential reasons, and when you do, distance, mask, and wash your hands. And do not meet outside the home if you are sick. Instead, get tested and please self-isolate. And see your loved ones virtually over this holiday so that you can stay in touch but keep each other safe. Sticking to this advice means that you will all have a chance to look back fondly one day at the strange year that 2020 was. Remember a couple weeks ago when I said just one social gathering has become the one? How tragic would it be to go for just one joyride in an ice storm without a seatbelt, and then to meet with misfortune just as seatbelts are coming into play? In our fatigue, we are sometimes forgetting that just one social gathering could make COVID-19 a disaster like any other tragedy. I get that the pandemic seems different to many, but it really isn't. This is actually a disaster that, to some extent, we control through our choices and our context that determine our interactions, which determines how hard this hits. And frankly, we all know that if an ice storm took out power lines and roads over the holidays, we would do the right thing and stay home to keep our essential workers and frontline responders who have to be out and about safe. So please remember that there is truly no place like home for the holidays this year. And by that, I mean celebrating only with those that you love with. I wish all of you a brighter 2021 and a happy and safe holiday season at home. Thank you, and I'll pass it to Mayor Crombie.
Thank you, Dr. Lowe. And before I take questions from the media, I want to acknowledge that while all of us will be celebrating quite differently this year, as Dr. Lowe just described, there are those in our community who are struggling much more than others. And if you can, please donate to a local charity. We have so many great charities across the city and the country that are doing so much to support those in need. And while COVID-19 has impacted all of us, it really has disproportionately affected our most vulnerable residents. There are so many to choose from here in Mississauga: the Mississauga Food Bank, the Compass, Interim Place, Arma House, toy drives for children, the Boys and Girls Club, and so many more. Another great one is the Shoebox Project that puts together a special gift for local women impacted by homelessness. This year, instead of dropping off a shoebox, you can go online and create a box virtually. It really is a fun and creative way to give back to those in need. If you can, please visit shoeboxproject.com to put together your virtual shoebox. This will be my last press conference for the year, so I want to wish everyone in Mississauga the happiest of holidays and a very Merry Christmas, and of course a happy, healthy, prosperous New Year. I know that 2021 couldn't come soon enough for all of us, and I know it will be a better year ahead for Mississauga as we move past COVID and back to a sense of normalcy. I want to thank everyone for playing their part in helping reduce the spread of the virus. Please remember to stay home as much as you can. Please only go out for the essentials, and limit your in-person contacts to your immediate families. Please have a safe and healthy holiday season, and please, Mississauga, stay healthy, stay safe, and now I'm happy to take questions from the media. Thank you.
Your first question comes from Isaac Cowan at The Pointer. Go ahead, Isaac.
Hey, Mayor Crombie.
Welcome, Isaac.
Thank you. I imagine you're aware, but there's a petition online with more than 2,000 signatures addressed to you asking for the city to reconsider its decision to demolish the Burnhamthorpe outdoor ice skating rink. There's obviously a lot of resident kind of interest and appreciation of this. That petition's got 2,000 signatures in two days. What do you say to residents who don't want to see this fairly unique rink, one of only three cool city maintains replace the swimming pool?
Oh, my heart goes out to the residents, absolutely. But the Burnhamthorpe Community Centre is slated for a rebuild and an expansion, and badly needed rebuild, as you will know. It's one of the older community centres, and in order to accommodate the expansion, we would have to lose the outdoor rink. But that's not to say we can't build another outdoor community rink in a different location close by, and this certainly won't happen this season, but probably will happen after the winter season, Isaac. So, it's for the good of the community that the community centre will be rebuilt. It does come at the expense of losing the outdoor rink, but there are possibilities for rebuilding that rink elsewhere.
Follow-up?
I'm sure they'll be happy to hear that. My follow-up is a bit of a change of gear, but a few weeks ago, you were on, obviously, the Police Services Board when it approved the 2021 budget. Now, I know you'll have a chance to comment on that again at the Region of Peel, but you said several times this year that you wanted to look at that budget through a different lens. You and Mayor Patrick Brown, you wrote an op-ed to that effect, and the budget was passed with relatively little deliberation and no changes asked of the chief. So I want to know what happened to that different lens that you promised.
Well, so certainly, Isaac, what you don't see is what happened in the background. We spent one day off-site deliberating the budget. Then we reviewed it once again in the Audit and Finance Committee. So that budget has been very scaled back to where it was when it started. I'm still very happy to report that it does represent, I think it's a 3.5% or is it 3.8% increase with an additional more than 20 officers in 2021. So I think everyone is happy that it is in the interests of community policing and keeping the community safe. It's not where it was when it started, but I think everyone was very satisfied at the conclusion.
Your next question comes from Steve Cornwell at Mississauga News. Go ahead, Steve.
Welcome, Steve.
Hi, Mayor Crombie. How are you?
I'm very well,
thank
you. Nice to speak to you again today.
Sure, yes, it is. And I was just going to ask you about, you mentioned earlier that I'm guessing city enforcement or bylaw enforcement officers aren't likely to go into people's homes to enforce kind of the rules over Christmas unless it's a larger gathering. So I'm just curious, how was that decision made? Is it a legal question? Is it kind of the city is just obviously not... it's a challenging optics, I guess, to be, busting into people's homes on Christmas. What can you tell us about how that decision was made?
Well, that and the obvious constraint is we don't have enough bylaw officers to do so. So as you know, we're proactive when it comes to inspecting businesses, but we're also reactive when neighbors call to report that there are a great number of cars at a local residence in the driveway on the street, and we will certainly continue to go and inspect when we get those calls to 311 suggesting that there are large gatherings of mixed households. But to suggest that there would be proactive inspections of people's homes, that's not in the cards. We don't have the manpower, capacity, resources to do so. So we're asking everyone to be on their best behavior and honor the protocols that have been in place and follow public health guidelines.
Follow-up?
Thank you. My follow-up, I think it's for Dr. Lowe.
Sure. I'll call him to the podium. Thank you.
Hi, Steve. Go ahead with your question.
Dr. Lowe, just wondering, I read this afternoon that Mayor John Tory was anticipating that kind of lockdown restrictions could get stronger for Toronto. So I'm just curious for the Peel situation. Lockdown is ending theoretically in a few days. So I'm just wondering if you're anticipating simply an extension of the lockdown or kind of more strict measures. And if it's the latter, more strict measures, can you kind of detail how much farther kind of the lockdown could potentially go?
Well, Steve, I think the first thing I would say is, indeed with the residents in the Region of Peel, regardless of where we are in the province's color-coded framework, I think it's important to heed the recommendations and advice On the basis of the numbers and the science alone, we still continue to see widespread community transmission, which means that going into the holidays, we really just need people to celebrate, with their immediate household and make sure that they are not hosting any social gatherings inside, outside, it's really important that people just not gather during this period. In respect of the question of lockdown, we are certainly in conversation with other health units and with our provincial counterparts to see where things go. I think, as you've heard from our remarks today, we have reached a plateau, but we are by no means seeing a decrease in viral activity, and our hospitalization picture still has not stabilized at this point in time. So I'd be very surprised if there was a loosening of measures at this point in time. Most of the conversations are focused on how we can ensure that our community continues to stay safe and we avoid overwhelming our hospitals and our intensive care units. So thanks very much, Steve, for the question.
Thank you.
Your next question comes from Jonah Shinuda with Mississauga. Go ahead, Jonah.
Welcome,
Hello,
Jonah.
hi, Mayor Crombie.
Hello, welcome.
Hi. So with the first COVID-19 vaccine entering Peel on Monday, I believe you said.
That's correct.
Do you know what the roadmap looks like for how it'll arrive in Mississauga, namely who will get it first and when?
So I will also ask Dr. Lowe to comment on this, but the good news is the vaccine is arriving in the hot zones and the lockdown zones and throughout Ontario on Monday. I believe there are 90,000 different doses, and as you know, there are 23 units, refrigerator units, that can accommodate the vaccine. So we are not yet aware what amounts we will receive and which specific locations will receive them, but we do know that both Mississauga and Brampton will be receiving doses of the vaccine. So that is very good news. And as you know, people will have to go to where the location that the vaccine is being kept for their immunization, because it has to be kept at very cold temperatures. And the people first in line will be those, I believe, who are frontline healthcare workers, especially those who are treating or are caring for our seniors, our most elderly, those in vulnerable settings, as well as our healthcare heroes right at our hospitals. So why don't I ask Dr. Lowe to comment on that as well. Dr. Lowe?
Thanks, Madam Mayor. Thanks, Jonah, for the question. In fact, Mayor Crombie has outlined the plans thus far that we're able to share from our understanding and our conversations with the province, and has also spoken to the focus really on being healthcare workers, specifically those that work with at-risk populations such as long-term care homes. So that is essentially where things are going. In terms of the overall roadmap, certainly the federal government has put out documentation which shows that this is occurring in 3 phases. Certainly in this first phase with limited capacity, the focus will be on vulnerable populations and the personnel or staff that serve them, and then after that it will move to vulnerable groups within the community as opposed to within institutions and otherwise, and then beyond that we'll be looking at offering widespread vaccination for the community. So certainly we're not at the end of COVID-19 by any stretch of the imagination. This is perhaps the beginning of the end, but we really must stick to the precautions, especially with a viable vaccine. It does no good if it hasn't been administered to you. And I think we also want to remember that when the opportunity does come, everyone is strongly encouraged to take the vaccine in recognition of the fact that if we get to a certain level of population coverage, that offers our best hope for returning to some semblance of a normal life. Thanks very much for the question.
Thank you. Yes, my follow-up is for Dr. Lowe as well.
Okay, sure.
Yeah, so it seems likely that we will see another surge in COVID-19 cases in January after the holidays. So I'm wondering, is the region anticipating introducing any new measures to counteract this new surge, and what might those measures be?
Well, it's a great question, Jonah. I think it goes back to my remarks, and I think I've made myself hopefully very clear that the holidays have to look different this year. It's not a usual time, so it's not a usual holiday season, unfortunately. And so to the extent that we are relying on everyone to try to do the best they can in doing the right thing to celebrate at home, then that's the first step of advice, and certainly encouraging and asking people to work along with us and treating this like no other, like any other disaster. If it was an ice storm, if it was a hurricane, you wouldn't be wanting to get together with your friends, you wouldn't be wanting to gather. And then I think, to the broader question of preparations for a surge, certainly we continue to respond. We're very grateful that the grey lockdown measures have bought us some time in having our cases plateau at around the 400 and 500 case mark. Obviously I shudder to think what would happen if enough people ignored our advice and subsequently we saw widespread circulation and increase in infections. So that said, our hospitals do have surge plans that they're continuing to move forward on. Ourselves in public health continue to make our recommendations and adjust our case and management and contact tracing processes as best we can, but we really need the community to help us out and make sure that we are stopping transmission in the first instance and keeping this line right where it is, especially over the holidays. Thanks for the question.
Your final question for the day comes from Khalid Salama from My Second Home TV. Khalid, go ahead.
Welcome, Khalid.
Thank you, Mayor. How are you?
I'm very well. Keeping
great.
healthy.
God bless you. Just want to follow up on the situation, whether there are any talks or progress going on with the banks to relieve the small business owners, especially, that they are on the verge of losing not only businesses, but their homes as well.
Yes, as you know, I have been speaking to small business owners, both restaurateurs and local retailers, and they have shared with me their individual plights and how some of the banks are calling their personal loans and their operating loans and lines of credit, etc. And I had the occasion to discuss it with the Premier, and he himself assured me that he would be calling each of the bank presidents to ask them to pull back on that policy just now. It's rather immoral to be doing that at this time. So hopefully that message got through. I'm sure that the Premier delivered it with a vengeance.
Thank you so much. May I ask Dr. Lowe about...
Absolutely.
Thank you so much.
Hi, Khalid. Go ahead with your question.
Thank you. What about the other type of the COVID vaccine, which is coming from Moderna? Do you have any plans for that? And whether you will be issuing any certification for the people who received the inoculation itself?
I guess you're asking two questions. So what happens when Moderna shows up and also inoculation status. First of all, we understand, of course, that the province is issuing records to indicate when someone has been immunized. This is no different than any other immunization records, and it's a good time for me as a public health physician to remind everyone of the vital importance of your yellow card, your Ontario immunization record. I keep mine with my passport, like it is that vital, just to know what you've been immunized against. So certainly the government will issue materials, as I understand it, to indicate if someone's been inoculated or not. And I encourage people to safeguard those along with other records of immunizations against other infectious diseases. And then in respect of the other vaccine, Moderna, again, we will wait to see if and when Health Canada approvals come down. But our team, in continuing to plan for the initial rollout in our region, which is anticipated to take place next week, it was also looking at the question of how that vaccine will roll out in our region as well. So, certainly stay tuned, and we'll continue to provide updates as we can through the various channels heading into the holidays. Thanks so much for the question.
That wraps up all your questions for today. On behalf of Mayor Crombie, I'd like to thank you all for tuning in. And while we don't have a press conference next week, you can stay tuned for updates on all of our social media channels and from the city as well on their website and on their social feeds. Thank you.
Thank you once again.